This is Professor Richard Scolyer, and he is a star right now.
Professor Richard Scolyer,
Australian of the Year, I'm proud to announce.
Professor Richard Scolyer
has made international headline for doing something doctors thought would be impossible.
Thank you. What an incredible honor.
Professor Scolyer managed to get rid of his own brain cancer, glioblastoma. And this is a huge breakthrough. Glioblastoma is the most common type of brain cancer, affecting about 3 per 100,000 people each year. That's approximately 240,000 people globally. Once you're diagnosed with it, you'll most likely die in a year, and that's if you treat it. If you don't, you've got only 3 months. Only about 7% can survive up to 5 years, but still, they have the tumor in their brain all this time. And this guy, he managed to survive for more than a year, and his MRIs that could show the presence of cancer are clean. This means he doesn't have cancer anymore, and it has not returned yet.
No recurrence, which is good.
Fantastic.
Professor Scolyer and his colleague Professor Georgina Long developed a highly experimental treatment, a huge part of which was a personalized mRNA vaccine. Yep, the very same thing you use against viruses. Studies and even some small-scale trials on using vaccination to fight cancer have been available for quite some time. But Professor Scolyer was the first person in history to use this vaccine in combination with other drugs and surgery on humans to cure his brain cancer and remain cancer-free to this day.
We have generated in 10 weeks discoveries that would normally take many years.
Hi, my name is Dennis Zhilin. In this video, I will explain what cancer is, Professor Scolyer's treatment protocol that left him cancer-free, how we can potentially treat any cancer with an mRNA vaccine, and how it can potentially help treat thousands of other diseases. To understand how the mRNA vaccine works, let's first examine what cancer is and how it appears in our bodies. Cancer is a disease caused by cells dividing uncontrollably, spreading into surrounding tissues and destroying them. Cancer can start almost anywhere in the body, which is made up of trillions of cells. Normally, human cells grow and multiply to form new cells as the body needs them. When cells grow old or become damaged, they die, and the new cells take their place. However, sometimes this process breaks down. Abnormal or damaged cells become rebellious and grow and multiply when they shouldn't. These cells may form tumors, which are lumps of these rebellious cells. Tumors can be cancerous, malignant, or non-cancerous, benign. Benign tumors are usually harmless. They stay in one area, and although they can become quite large, they will not invade nearby tissue or spread to other parts of your body. Although a benign tumor is not the most pleasant thing to have, it does not threaten one's life as much as a malignant one. Cancerous tumors can spread into or invade nearby tissues and can travel to distant places in the body to form new tumors. This process is called metastasis. Cancer cells differ from normal cells in many ways. For instance, they grow without signals telling them to grow, ignore signals that normally tell cells to stop dividing or die, invade nearby tissues and spread to other areas of the body. They hide from the immune system and can also trick the immune system into helping cancer cells stay alive and grow. This means our body cannot fight cancer on its own. Then cancer grows, invading more areas in the body that lose their functionality, leading to health problems and eventually death. Nowadays, the standard treatment of glioblastoma includes a surgery to remove tumor and an intensive regimen of chemotherapy and radiation therapy to kill the remaining cancer cells. The surgeon will try to remove as much tumor as possible. However, glioblastomas spread over a large area of the brain and have a plethora of tiny tentacles that infiltrate the brain, which makes them very difficult to remove completely. This is especially true when the tumors are growing near the important regions of the brain that control language or movement. This makes 100% removal nearly impossible. Current standard treatment does not cure cancer. It does not kill every tumor cell, and the tumor grows back. The average length of survival for glioblastoma patients is estimated to be only 12 to 18 months. if it's treated. Professor Scolyer's case shows that mRNA vaccines in combination with standard treatment can help completely remove glioblastoma. Until Scolyer's case, this was impossible. The human immune system acts like our body's police department. It has evolved into fighting everything our body considers a perpetrator: bacteria, viruses, deviated cells, etc. However, our immune system is really bad at distinguishing rebellious cancer cells from normal, healthy cells. This is because cancer cells originate from normal cells, which helps them hide from the immune system. Our immune system literally doesn't know what cancer cell looks like.
With the help of an mRNA vaccine, we give our immune system a description of one more enemy, cancer cells.
mRNA, short for messenger ribonucleic acid, is a molecule that instructs cells on how to make proteins, including those that can stimulate the immune system. The original instructions for building these proteins are stored in the cell nucleus in our DNA. They are transcribed there into mRNA. Once the mRNA, including the construction plan for a protein, is produced, it accesses the cell nucleus and presents the instructions to ribosomes, whose job is to read the instructions and assemble the corresponding protein. mRNA vaccines deliver an mRNA instructions into our immune cells that recreate a protein found only in cancer cells. This teaches our immune system to see cancer and distinguish it from normal cells. It's something like we give our immune system a mugshot of a rebellious perpetrator.
Developing an mRNA vaccine and delivering it into a body is a very complicated process. This is how it works.
At first, the patient undergoes a surgery when the tumor or part of it is removed. A tumor sample is sent to the vaccine production facility. There, with the help of an AI, it's being analyzed for the presence of protein markers that could clearly distinguish the cancer cell from a normal body cell, so-called neoantigens. These markers are different for every patient, so these vaccines are personalized. The more cancerous markers scientists can find and put into the mRNA, the more information the immune system will have to identify the cancer cells. Then, the mRNA molecules that contain blueprints of cancer-like proteins are created and put inside the lipid nanoparticles. These nanoparticles are incredibly tiny pieces of fat that protect the mRNA. Because of their layered structure, the most advanced nanoparticles contain a large amount of mRNA. The scientists describe them as the buttery sheets of a flaky French pastry. Yummy! The vaccine is being sent back and injected into the patient's body. After being introduced into the body, the nanoparticles are taken up by cells, largely the dendritic cells that are immune system components. Once the mRNA has entered the cell, the cell's ribosomes read the instructions and produce the cancer-like protein. This protein is then transported to the cell's surface, where it can be detected as an intruder by the patient's immune cells, such as T cells. The immune system recognizes these proteins as foreign or dangerous, causing it to attack anything with that protein on its surface, namely cancer cells.
Dendritic cells act as teachers, educating T cells so that they can find cancer cells and kill them. Furthermore, an immunological memory is created to fight cancer if it reappears in the future.
In the case of Professor Scolyer, he also goes for a complete tumor removal surgery and a set of chemotherapy drugs.
Thanks to this world's first treatment, Professor Scolyer became the first brain cancer patient to have his glioblastoma completely removed.
There is still a chance that glioblastoma might come back, but for now, a year after treatment, his MRIs are clean. Although all the components of his treatment were known in the scientific world before, he was the first to combine and test them on a human subject, himself. He did what no one ever did before him, and he still remains tumor-free, which is also an achievement considering that glioblastoma can hardly ever be completely removed. He has received his innovative treatment due to their pioneer melanoma studies with his colleague Professor Long. Together, they discovered that immunotherapy works better when a combination of mRNA vaccine and drugs is used and administered before any surgery to remove a tumor.
This truly breakthrough treatment may help roughly 300,000 people with brain cancer globally each year. The results of this trial are expected to shake up the world of cancer treatment that remained unchanged for the 19 years for millions of patients. Although this treatment is truly amazing, brain cancer is not the only disease it can cure. It goes deeper. mRNA vaccines have been effective in pet dogs with brain cancers and in a clinical trial involving 4 people with glioblastoma that was surgically removed. The researchers saw multiple indicators of rapid and strong immune response from the cells that are responsible for killing tumor cells. The world's first personalized mRNA cancer vaccine for melanoma has halved the risk of patients dying or disease returning. Other trials have shown significant improvement in survival for breast cancer patients and potential in treating pancreatic cancer. Trials are underway for other cancers too. mRNA can also treat viruses like HIV, hepatitis B, and herpes by training our immune cells to recognize and eliminate infected cells. mRNA can also help with autoimmune disorders. An autoimmune disorder occurs when the immune system sees normal cells as intruders and attacks them. The effects of an autoimmune disease can be as harmless as plaques on the skin and as harmful as the inflammation of the whole body's nervous system. For autoimmune disorders, mRNA vaccine can teach immune cells not to attack the body. mRNA vaccines can potentially help with allergies by desensitizing the immune system to the allergen. Lastly, vaccines can supply our cells with missing instructions that are required to produce proteins in our bodies and alleviate symptoms. The downside is that additional doses would be needed as the effect wore off. And this list might go on and on the more we discover the ways this treatment might work. Professor Scolyer's story and all these diseases that can be potentially cured in the future truly sound like miracles. However, success is far from guaranteed, and the field is thick with unresolved questions. It's really important to understand that this treatment is highly experimental. While the results are really promising, the odds of complete cure are considered minuscule, and the treatment is primarily expected to prolong life. And it's not yet clear how personalized cancer vaccines should be best combined with other treatments. The companies that are developing the vaccines are trying to understand which cancer stages will benefit the most from such treatment. They are also searching for improved ways to predict the most effective neoantigens. It is still unclear whether an mRNA vaccine or maybe some other vaccine is the best way to activate our immune system to fight cancer. It will take some time, trials, and errors. But if the vaccine is found to be effective even from the half of the diseases mentioned, it will still be a huge win. It will save lives of millions of people worldwide. Professor Scolyer's story is an amazing proof of concept, and we are looking forward to seeing what it develops into in the future.